with COVID changed. We were getting it from the Alabama Department of Public Health, and we started getting that from a vendor supplying that last week. There were some glitches in the distribution of the drug last week. We ultimately got our shipments of remdesivir, but continue to be concerned about whether we'll be able to get those long term, particularly if our number of inpatients were to continue to go up. Main concerns continue to be testing. I preach that every time I'm up here. And then the second concern is just staffing the hospital when there's more COVID in the community. More of our employees are getting COVID, so they have to be out, or a family member or loved one has COVID, so they can't come to work. And then the latest issue is school's not going back in. Patients going to stay home and be homeschooled. That creates a problem because now we've got workers who are going to have to be at home being educators, so they're not going to be able to be at work working. During the summer, it wasn't quite the issue because children weren't having to be educated. It was the summer; they were doing other things. But now that someone has to be there with them, providing education, it's going to create a problem for our workforce at a time when we and this is not just us. This is throughout Alabama and anywhere they're having increases in COVID. We are looking at what we could do to assist with that. At one point in time early in the process, we actually opened up our own kind of a place for children who of our employees where they could go out at Cochran, and we ran some day classes. We can't do that because it's no different for them to be there than to be in school. We will look at expanding our daycare to see if that helps, so that we can get some employees that currently could come back to work if they had daycare for the little ones, to try to get them back into work by expanding our daycare to try to increase the employees we have at the hospital. We are continuing to manage workflow in the hospital. We're doing very few elective inpatients anymore. We might do an urgent one, but most of our elective inpatients we've deferred, either moved them to Madison or put them on the list to do later on when things slow down. But situation is pretty difficult right now. I will tell you, the morale is unbelievable. Staff, physicians, everybody who's in the middle of this, they're doing a great job. They're not complaining about anything. We're blessed to have a community of people who step up and do what needs to be done when we're in the middle of a crisis like this, and we certainly appreciate it at our organization. Thank you.
Thank you, Mr. Spillers. Now we'll go to Mayor Tommy Battle, City of Huntsville.
And I'd like to start off by just saying thank you to the healthcare professionals who are out there right now. I mean, you're facing a lot of challenges right now. You're facing full hospitals, and also you're facing, how do I make sure I can still go to work and take care of my children? So you're facing a lot of different problems. If you look at today, tomorrow at 5 o'clock, we will be 3 weeks into the masking ordinance in the state of Alabama. Tomorrow at 5 will be 2 weeks into the masking ordinance. We're starting to see some curve, or some flattening of the curve. In the last week, we had 750 cases. The week before that, we had 950 cases. So of positive COVID-19. So from what we're able to see at this point, there's a very small juncture that we're looking at. We may be starting to have some success with our strategies of what we're trying to do, but that success has got to be the state success too, because as I've said many times, we have 110,000 people a day come into the city of Huntsville. They work here. They go back to their other communities. We want to make sure those other communities are safe also. We are facing some of the same problems and challenges, I think, right now that the hospital is. We have 2,400 employees for the city of Huntsville, and a lot of those employees have young people at home, and are going to have to be working on the education of those young people for 9 weeks as we go through the school processes. So we're looking at some alternatives and looking at how we can help those employees and work with those employees so that they can do their primary job job, which is take care of their family, but still be part of our workforce. And that's part of the challenges I think that everybody has out there right now, is how we do that. When you look at cases per 100,000, we're pretty much tied. We have 78 cases per 100,000. Montgomery has 471. Jefferson County has 504 cases per 100,000, and that's in the last 14 days. So if you look at the last 14 days, we have one of the lowest levels, or very close to the lowest level that of any of the major cities in the state of Alabama. So we're starting to see some turn. I think they will also see the same thing when they get to the same stage we are with the masking and some of the other efforts that we've been doing. But, masking by itself is not going to do this job. We've still got to stay separated. We've still got to stay sanitized. We've still got to continue all the things that we've done to get us to this point today. And to each of our citizens out there, thank you for taking this seriously. This is a very serious thing for our community, and our citizens are taking it very seriously and doing a good job with it. So thank you for all your work and for your patience with us as we go through this.
Thank you, Mayor Battle, and thank you for watching today. We will be back here again on Wednesday, July 29th at noon for another briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Kate Smith with 48 News. Mr. Spillers, do you know about how many staff members will be affected by their children not going back to school? And I know you briefly spoke about it, but what are you really thinking to do?
Yeah, I don't have that number, but as you well know, a large number of our nurses are younger nurses with families, and they're going to have to deal with that. We have a lot of single parent families. So I don't have the exact number yet, and probably won't get an exact number. But we're getting a lot of phone calls into HR saying, what am I going to do? My choice is stay home and educate my child or come to work, and I got to do both. So we're trying to work through that. It could have some pretty significant impact. Today we're probably down about 200 employees with COVID or a loved one with COVID. So that in itself's difficult. You add another 200 of that, and things start getting very difficult to staff some of the areas, particularly when you're full. That's tough.
Sure, great. And then my follow-up question, today it was announced that bars no longer will be selling alcohol after 11 o'clock, last call. Mayor Battle, have you had conversations with the local bars about that, and how are they feeling?
We've been working through some of our groups that work with the local establishments, and have tried to make sure that we can accommodate them, and also that they understand what the law is going to be, or the rules, the health order rules are going to be. Thus far, the ones that we have talked to have been that they felt very good with it. It's a safety catch for those who are restaurants, for their employees going out at night and maybe coming back the next day and not have practiced all the masking that they need to. So thus far, we've gotten good reports on it.
Great, thanks.
Sorry, I wasn't trying to cut off your head. Sydney Martin, Way 31. My first question is for Mr. Spillers, and then Mayor Battle, if you'll also answer. So I know you talked about school returning a little bit, and you said there's right now no high school or school-age children hospitalized. What are your thoughts about sports? Is it safe for sports to happen if kids aren't back in school for in-classroom instruction? Is it not safe, and why?
Well, I think when you talk about safe, are you talking about safe not to get COVID at all, or not to get sick enough to be in the hospital? I think if you look at those anybody playing sports is going to be at risk, just like any other person who is not socially separating and have on a mask. So I think they're at risk for getting COVID. Statistically, the risk of those people ending up in the hospital is relatively low. That's just the way the numbers work out. People in that age group for sports, high school sports, just don't tend to show up in the hospital very much. But I think it's very possible that you'll see outbreaks of people who get COVID in that age group from team sports, because they're going to be close together and they're not going to be able to do the things that we preach.
You know, team sports, I would love nothing better than to see team sports happen this fall, but I'm going to leave it to our health officials to determine if it should happen and if it should not. We're seeing some moves in Major League Baseball right now where they started off, then they've had to pull back. So I think that there'll be some learning curves off of that, and we'll lean towards listening to Alabama Department of Public Health or Madison County Health Board, and our hospitals on both Huntsville and Crestwood Hospital, be leaning on both of them for guidance in some of this.
And then to follow up on that, if both of you will answer, I know Mr. Spiller said that people could probably get sick, athletes, and that there could be outbreaks. If it's not safe to send back kids to the classroom, do you think it's unnecessary or it's not a good idea because sports aren't maybe essential?
Mr. Spillers, we'll talk about essential. You know, I think a lot of us kind of feel sports are almost essential, but they're not. And we're going to be listening to our healthcare providers. Our healthcare providers are going to be able to give us a little bit better picture of it. Right now, we're sitting, probably 30 days away from when sports would be starting to happen, if you're talking specifically football. But there's a lot of other sports that are team sports that might work out very well. Cross-country running and some of those might work out very well. So we're going to have to watch, and we're going to have to evaluate each one of them.
Yeah, and I would say that, families need to determine. Families who have children who are going to play team sports, they're the ones who need to determine if they're willing to accept the risk of somebody getting COVID from a team sport. I can't sit here and put a percentage on the risk, whether it's going to be 10%, 50%, 70%. Family members need to make that decision. And I'm also one who, I just don't think we can just quit life and just go into the house and stay and not come out and not do. I think there's repercussions from doing that. I'm a firm believer we've got to move forward. We've got to go do some things. We've got to be very thoughtful about what we do and making sure we're trying to keep people protected as much as possible. But I tell you, telling a senior in high school he's not going to play football this year might be as devastating as getting COVID and staying at home for 2 weeks. So I think everybody's got to look at that risk and determine whether they're willing to accept that or not.
Kelly Smith with WHNT News 19. This question is for Mr. Spillers. You talked about the testing supplies for the hospital, getting 600 tests cut back for testing for staff. I wanted to see, how will that affect the hospital? How many people are getting tested per week? Will that mean that people that need to get tested maybe not be able to get that kind of rapid testing? And also, I was looking at the press release for the testing in town through the drive-thrus. At the very bottom, it said that test results could take up to a week. So I wanted to also have you share your thoughts on, what does that mean, and how could that affect spread in the community?
So on the first question, we'll have to manage around 600 less tests a week. We think we can do that. We'll use some outside testing if we need to. We'll use some of the local labs at Hudson Alpha that have turnaround testing that's quick enough to meet our need. But the fastest, least expensive tests for us to run is the ones we do in house. So anytime we go have to do 600 more from the outside, it's going to slow down certain things. might mean a patient's waiting a little longer before they get a diagnosis, and the whole time they're waiting, we're treating them as if they have COVID, those types of things. Might mean an employee goes home for 2 days before we get a test back instead of get a test back the same day. It's an inconvenience, but we'll manage around the 600 list. If all of a sudden we didn't have in-house testing, it would be very difficult to run our hospital right now. As far as the outpatient testing, several weeks back we quit doing any of those tests in our lab because we had to allocate all of our in-house capacity to our employees, physicians, and our patients. Those labs are backed up just like around the country. I mean, and you've probably heard conversations at the national level about the lack of ability to test people as fast as we need to be able to test them. So those lab dates have stretched out. We were running about 4 days turnaround from most of our outside labs. Last week we had some that were a week out. That's why we're saying up to a week out. And I hate to tell patients this, but when you get tested, you obviously think you have COVID. If you think you have COVID, you need to stay home until you find out positively or negatively whether you have it or not. That is the right thing to do. That's how you keep other people safe. And it's a major inconvenience because you may come back negative, but you've done the right thing. You may have saved someone else from getting COVID. So if people will quarantine until they get their test back, there's not a problem. The reality is, though, a large number of people don't quarantine waiting on a test. We got a large number of people who test positive and they don't quarantine. So it's not like everybody's paying attention to the rules.
And this next question is for Mayor Battle and Mr. Spillers. Over the weekend we heard that there were outbreaks at churches across North Alabama. And then today we see the ABC board say that restaurants can't be open, or restaurants and bars can't serve after 11 p.m. With that, do you think that this strategy will work to help decrease the spread of COVID-19? I know that hospital officials have said that those are risky areas. And then also with the first part of that question, is it concerning to see these kinds of gatherings? Is there any kind of message for congregations or churches that are getting together and holding services?
Most of the churches that we've seen, most of the communities of faith have even held off on having services. There are some who are having some outside services, but they're making sure they stay socially distanced. They wash hands, they wear masks, they do all the things that are necessary. At least that's the ones that we have seen within Madison County. So I think they're doing a wonderful job of it, and they're making sure that that it works. The restaurants and bars and nightlife places that happen after 10 or 11 at night, that will help the problem. Some of those are some places that we've had some concerns with. We've been watching very closely and have been monitoring. But it seems like after 11 at night and you have alcohol involved, a lot of the masks seem to come off. And so I think this will be just part of our strategy that we're doing right now. Face masks is part of our strategy. Staying separated is part of our strategy. Washing hands is part of our strategy. And now making sure that all that happens after 11 is part of the strategy too. I think it will help.
Yeah, and I would just add, I think any kind of large gathering of people is a high risk. I mean, you're putting everybody in that room at high risk. So why do it? I just think it's not the right thing to do where we are. It's an inconvenience not to do it, but I think that's where people should err on the side of caution, and we shouldn't have large gatherings of people in an indoor facility of any kind if we don't have to. My opinion. As far as the bars at 11 o'clock, I've been concerned that bars were an opportunity for a lot of people to potentially spread COVID just because of close contact. People are drinking, so they don't have masks on, and they're talking, and there's music, and people are close. So I think limiting the time people spend in bars will certainly be a positive as far as the additional people that get COVID.
Thank you.
Paul Gaddis from AL.com. This is for Mayor Battle, Mr. Burwell, and Mr. Spillers, any or all of y'all. We see reports of outbreaks at churches. We've seen reports of outbreaks at family events. We've seen outbreaks at various workplaces. Why is it that we haven't necessarily heard or seen about outbreaks at these bars or at restaurants? Are they happening and we just don't know about it, or what can y'all, anybody got any theories on that?
Mr. Birdwell?
Well, I will say the data doesn't exist for that. Typically, we don't have information on numbers that may be exposed at a particular place like a bar. Some of the other places that you had mentioned, you get information that you can tie that back to it. So I think that's probably the answer to that.
I would concur with that. Contact tracing back to a bar is very difficult for a variety of reasons, but doing that to a church or a social settings a little bit easier to do.
Does common sense or what we know about the spread of COVID, can it be assumed or can it be believed that there have been outbreaks in restaurants or bars? We just don't necessarily know about it, or we can't necessarily tie it down to one particular establishment? Or is that too big of a leap to make? I don't know.
That would be my guess, and simply a guess. You just don't have the information, to tie that to a specific place. As David said, you're not tracing, doing contact tracing there. So, the assumption could be they could have had it been infected anywhere, just because we don't have the information related to that.
And just some of the common sense that we have to work through in some of this. When you're doing contact tracing, it's very easy for someone to say, well, I was at church, or I was at a social gathering, I was this. Probably not as many people admit that they were out till 2 a.m. at a bar or something like that, and that's probably one of the reasons that you don't have as much contact tracing on things like that.
Right. And just one last quick question, please, Mayor Battle. With the ABC board deciding to close bars at 11 o'clock, how will that be enforced? Will that fall on local police, or what's the deal with that?
Yeah, and I believe it's not actually closing. I think it just says you can't serve alcohol after those hours, and we'll just we'll monitor them the same way that we've been doing everything else. And some of the like the Restaurant Association, the Brewers Guild, and some of those are all putting out notices to all their membership so that all their membership can make sure that they have it too.
At this point, we'll conclude the press conference. Thank you for coming.